So another question that I wanted to ask you was the idea of the relationship between a PT and, a personal trainer and a physical therapist. I really have thrived with my relationships with physical therapists. I find it a great way to learn things, to really get away from maybe your own biases as a strength coach, as a personal trainer, and to realize that you don't have all the answers and someone else should really be doing the job that maybe you feel like you could do. Especially with FRC, it gets a little bit kind of like where, you're not really, closing angle pain is a really good red tape to stop at, but I do find that because you have such great tools, it's kind of almost, there's a little bit of pressure to keep going on some of those things. So with that being said, what are some of the keys that you would say as a personal trainer, maybe a couple of things that would be good for communication with working with the physical therapist, maybe like I said, some red flags like closing angle pain, anything in that realm really.
So anytime I'm dealing with a person that's been referred to me from a personal trainer, some of the things I'll typically ask for are how long has that closing angle pain been there? Has it been there from day one and it's never gone away? Or was it the introduction of a new activity? Because that might clue in as to the nature of the injury. But I also want to know this trainer's relationship with the client, how long they've been working together for, and any other big symptoms they might have had. And even then, what will happen is when the person comes to me, I'm going to not believe anything they say from an injury history perspective, because humans have this tendency to forget a lot of what they would consider minor check marks on their history. But to me, they're all pieces to the puzzle, right? So, and normally with most personal trainers, they're not asking the same type of injury history questionnaire that we are. Once again, I think the beauty of FRS is that it's taking the emphasis away from like, hey, are you here to lose weight, right, to look better? At least they're putting that mindset with personal trainers as to, hey, how well do these joints actually work, right? And so do these joints work well enough so that you can do squatting, bench pressing, whatever the case might be.
Yeah, that really is a crucial factor. That's why some of the things that I suggest for an FRA, I think when you enter the FRS world, you really, at the very least, understand what you shouldn't be doing with your client, because when they come out of that with no hip, no shoulder, and then you're programming really heavy, ass to grass squats and shoulder press, you can just immediately be like, wow, I messed up. We should take this out,
Right.
And then the landmine and the box squat are options, but that's really one of the biggest things. And like we were just talking about Dre's ability to simplify things. That one, 4 things where it's, assess where they are, program within their capacities, work on their capacities while you're working on that, and then reassess. I really do love that thought process. I think it's really important.
Yep.
That's money. So another question that I had for you was the idea of buy-in. It's really obvious that nothing's going to happen long-term from just one single treatment, and the person buying in and really doing the work is what's ultimately going to change their life, change their tissue at a certain level, change their biology, however you want to put it.
Right.
So what are some strategies or some advice that you'd have for getting buy-in from a client or a patient?
Right. So, so one of the things that I emphasize right off the bat is that, to paraphrase Dre, is like, no one in the history of the world has gotten to be where they're at by having other people do it for them, right? You've never seen a gold medal, gymnast come up and say, I'd love to thank my massage therapist for making me this, bendy, or whatever the case might be. So when they understand that they're not going to get strong unless they lift the weight, they're not going to get the mobility unless they put in the work, that's key number one. And then number two, what they have to understand is that, whereas they might come see me once or twice a week or once every 2 weeks, I like to just use the pie chart analogy. Okay, so if we pie charted your 168 hours in a given week, right? here's an hour or 2 hours where maybe you're trying to make your stuff work better, and then the rest of the pie chart is you're getting a little worse, right? So you need to be consistent and offset stuff, and it's not going to happen with just my hands, putting inputs into your body. It's you doing the work.
Yeah, I like that. I like the visual of the pie chart. I think that's really strong. And at the end of the day, it's really empowering through education. The more the person really knows, the more they'll be able to buy in. Right. I think a lot of people shy away from really, explaining and educating their client or patient. And I think that's something that FRS and definitely yourself does really well.
Yeah, and so, on that side of things, ultimately, if we consider movement to be medicine, which I absolutely do, what do they do with kids' medicines? They change the flavor so that they're enjoyable, bubblegum or whatever the case might be. So I'll tell people, hey, if movement is your medicine, you need to find a flavor of medicine, something that you enjoy doing, so that it's not a burden for you. It's not a I have to. It's more. It becomes then a I get to, right? So like for example, like you tell me, my friend out there, Jen, will tell me, hey, we're going to go on a trail run. I'm like, yeah, thanks, but no thanks. But if you tell me, hey, we're going to go play basketball, you don't have to pull my arm, right? Or if you tell me, hey, we're going to go hit balls, I'm like, yeah, I'm in.
Yeah, so finding the common ground for the client to really kind of find, movement at all costs.
And that's for those who don't have that activity that they want to get back to. Like obviously you bring me in a BJJ player who's hurt and wants to get back to rolling. Of course, that's easy for them to say, hey, this is how you get back to BJJ. But for the person who hasn't found that just yet, it's like, this is your chance to go explore and find something that maybe it might turn into a passion for you.
Yeah.
Ian, where does this all go for you next?